all of you as community partners for joining us. As we rolled out this cell phone app, we wanted to connect with different community partners, different groups of folks in the community, because we think it's really important to have this type of outreach. And I thought it was just, especially important to connect with the disability community because we believe there is really strong utility in this app. One, for the clients, the service residents that all of you serve, whether they're in a assisted living home or they are out in the community or they're at their parents' home or at a support housing. They are, we know the folks you serve are some of the most vulnerable people in the community. And in addition, your staff members who have to provide those supports are at risk when they are out and about in the community. So this, the whole thrust for this app began in the summer. And former Secretary Dr. Kara Odom Walker and former Chief Information Officer James Collins were part of a 7-state consortium coalition. And they were looking at ways to expand our ability to do contact tracing. We know about 2/3 of the people our case investigators contact, we actually reach. So there's a third we don't reach to start with. And then think of you as a person when we do reach you, and then you're trying to remember who you had contact with in the past few days. And it may be a grocery store clerk, or in your cases, it may be somebody who came in or out of a group home or supported housing. So we sometimes don't know all of the names of the people we come in contact with. So this app kind of goes beyond that and uses technology. And that was one of the things that Secretary Walker and CIO Collins were looking at, was how could we embrace technology to help bridge this divide. And this app uses, and I'm joined today by a couple of my colleagues, Ben Hamilton, also known as William on your screen. William Ben is our project leader and our IT expert on how this technology works. And Andrea Wojcik is a colleague, communications colleague, the head of communications for the Division of Public Health. And we have been working to roll out this app across Delaware and across community populations. And we are very pleased to join you today. But the technology uses Bluetooth, and Ben is a better explainer at this about how it works. But think of this as having that kind of power of contact tracing in your pocket or your purse or wherever you keep your phone, and exchanges signals. And Ben actually has a video to help explain this. But if you are within 6 feet of someone for at least 15 minutes, and that other person has the app on their phone, you are exchanging these we call them keys, between your two phones. And if that person later tests positive, our Division of Public Health, when they talk with them, when they start to investigate the case and they ask them if they have an app, then they upload a 6-digit code. And that code goes up to the phone, and then through the phone, and then anybody who's been in touch with that person for at least 15 minutes within 6 feet will get this exposure notification alert. So it really is just smart technology to say that you may have been exposed to someone with COVID-19. Now, the app doesn't know if you're wearing a mask, and that is the single best thing that you can do, that we all can do to stay safe and healthy, is to wear a face mask. So it doesn't know if you have been wearing that one, but it's really important to know about our potential exposure, our potential risk, and this app is just another layer of personal protection. That's what we call it. So I'm going to stop talking and let Ben take it from here and show the demo. I think the video, it really explains how this technology works. And as we go along, if you have questions, please feel free to share them in the chat. So I think that will help us stay organized, and we will have an opportunity at the end to have a Q&A session. But as we're going along, if you just want to pop a question into the chat, then I will get to them and we'll ask them as we go. So thank you everybody again for joining. I'm going to turn it over to my colleague, Ben Hamilton.
Thank you very much, Jill. It's a pleasure to be here and help with this presentation today. Before I start the video, one thing I wanted to let everyone know is during the development process, We wanted to ensure there's accessibility standards are met. In this particular case, the web content accessibility guidelines had to be met. It was tested across multiple groups, multiple agencies with disabilities. In addition, our division for the visually impaired did a full review top to bottom of the application, and all of this was done before the app was even brought out to the public. At this point, I'm going to share my screen, and I will begin the video that Jill has mentioned.
When you open the COVID Alert DE app for the first time, you will be prompted to select your age. If you are under the age of 18, the application will thank you for your interest and inform you that you do not meet the age requirement to use the app. If you are over the age of 18, the application will take you to the onboarding screen. Here you will review the 3 key features of the application: exposure alert system, symptom check-in, and updates. Privacy is paramount to the COVID Alert DE application. On the next screen, you will review the data privacy policy and have the option to submit anonymous app usage statistics. You can review the data and privacy policy anytime online. Next, you will be prompted by COVID Alert DE to enable the Exposure Notification System, or ENS, on your device. During your first COVID check-in, the application will ask you a series of optional demographic questions. Any information you choose to enter will remain anonymous at all times. Once every 24 hours, you have the option to perform a daily COVID check-in. This anonymous information can help you keep a record of symptoms or changes in your health that you may be experiencing. If during the COVID check-in you record any symptoms that may be related to COVID-19, you will be presented with recommendations and links to additional information about COVID-19 from the Delaware Division of Public Health. COVID Alert DE also provides updates on the fight against COVID-19. If the exposure notification system detects that you may have been in close contact with someone who has tested positive for COVID-19, your device will generate an alert and prompt you to open the COVID Alert DE application for further information. If you have tested positive for COVID-19, a member of the Delaware Contact Tracing System team will reach out to you. During the interview process, they will inquire if you have the COVID Alert DE app installed and if you would be willing to upload a 6-digit code that allows your phone to share special anonymous keys, which are random numbers that change every 10 to 20 minutes running in the background. Once you upload the code, the app can now work with the ENS on your device to upload the anonymous keys. The app does its work in the background, checking your phone's keys against keys from other phones it has been near since the date they were tested. If there's a match, COVID Alert DE alerts the individual. Download COVID Alert DE free in the App Store or Google Play Store.
Thank you very much for watching that video. As Jill has mentioned, this app uses what's called Bluetooth technology. It's a low energy communication between devices. More or less, when your 2 devices are next to each other, they will continuously exchange keys that have no way of tracking one another. That's one of the key things, is anonymity that is required by both Apple and Google. As the video explained, if a contact tracer reaches out to you stating that you have been exposed, they will offer you the chance to upload those keys, which will then be shared across multiple states, which I believe Jill will be touching on momentarily. That is pretty much the information behind this. When we get to the Q&A section, please feel free to ask any questions or pop them into the chat window and we'll answer as we go. Andrea, I'm going to hand the reins over to you now, if it's okay.
Great, thank you, Ben. As Jill said, my name is Andrea Wojcik. I'm the Communications Director for the Delaware Division of Public Health. And in a moment, I'm going to share my screen. One of the key things that we wanted to do, obviously, when we launched this app was to spread the word about it as far as we possibly could. So marketing became a key function of promoting this app. And what I'm going to talk about is our marketing efforts to promote the app. Let me pick this screen. All right, let me try and show it in actual PowerPoint mode. There we go. Okay, what you can see here is our central logo for promoting the COVID Alert DE app. It talks about protecting yourself and slowing the spread, and what is in the center of the screen is someone's hand holding a cell phone with COVID Alert DE in the center. One of the things that we did was developed a series of toolkits that would be available to various partners and can be available to you as well if you wish to help us promote the COVID Alert DE app. So through this, I will go through what we have available in terms of print materials and digital materials on the web. So first, let's look at print materials. What we're showing currently on the screen are both the English and the Spanish versions of our poster/flyer. So the toolkit has the poster that you can print out, and it has the basic logo along with the COVID Alert DE specific logo that you would see on your cell phone. It says a free phone app that protects you and your privacy. And it has the icons for the App Store and Google Play, as well as the state seal. There is also a version that is customizable so that an organization that wants to drop in its own logo can do so. We know that a lot of people would have questions about how this app works. As often as we explain it, we always come across new ways to try and improve our explanations. So one of the easiest and most important things that we thought we could do was provide a frequently asked questions document. That is also available in English and Spanish. So let's move to talking about the digital materials. First thing that we wanted to show you is we have a web page that is dedicated to this. It is de.gov/COVID alert. And COVID alert is all in lowercase letters if you're entering it. Very important. If you do capital letters, I'm not sure that it will actually take you to the website. But on the website, it'll provide a link that will show you how to get to the Play stores to be able to download it. It shows videos that are available. One's a longer form one produced by Apple and Google than the one that Ben just showed you. And then there's a shorter 15-second version that I'll show you as well. Another key factor is that we wanted to be able to convey this information in Spanish so that everything that is on the website is also available in Spanish. The website has buttons that contain, that contain the toolkit materials, and it also contains a basic explanation as to how the app works. So we encourage everyone to visit de.gov COVID alert after the presentation to learn more. What's on the screen now is an example of static web banners. So if this is something that you are interested in putting on your organization's website to promote it, there are different sizes of the web banners that you can use. Those are available in the toolkit. Again, this is what it looks like in Spanish. This is an example of putting a Facebook cover photo up on your Facebook page. And we used a mock-up of the DHSS Facebook page as an example. Similarly, there is another one for Twitter. We also created a customizable email template so that you could send out a blast email to members of your organization, available in both English and Spanish, and it has basic information about the app and how it works. You can drop in your own name and make it customizable to your organization. We also have social media templates. So if you want examples of not only the graphics to put up, but also what to say about the app, that template information is contained within the toolkit. And now I'll play a 15-second video that we also have up on the de.gov COVID alert website.
Now, there's a phone app to protect you against COVID-19. It recognizes if you've been in close proximity to someone with the virus and tells you what to do next. The more people who download it, the more people it protects. Download COVID Alert DE free now.
So of course the video is great for social media platforms, as well as us having the template content for Facebook, Instagram, and Twitter. And just a quick review, everything up here is an example of what is contained within the toolkit that can help you in your marketing efforts for this app. We're very excited. I think one of the key functions that we did was creating these toolkits and providing them to several of our partner agencies, and it helped get us to the over 38,000 downloads that we've had since the app launched on September the 15th. So we certainly hope that we can include your organizations as a partner organization. We would also be more than willing and excited to add your organization's logo to the de.gov COVID Alert website and include you as one of the partner organizations listed there. So at this point, I will turn it back over to Jill, and we're happy to answer any questions that you have.
All right. Thank you, Andrea. Before you go, I wondered if you could share, you shared that we are over 38,000 downloads on the app, but can you also talk about how many people we have found in terms of the case investigators and contact tracers who have had the app on their phones?
Yes, absolutely. Thank you for mentioning that. Our contact tracing team have indicated that since launch, of the people that they have interviewed as positive cases, about 9% said that they had the app downloaded on their phone. This is incredibly important because if you test positive, in order to upload the 6-digit code from the contact tracers, you already have to have the app downloaded on your phone. It's not useful to download it at the time that they are first contacting you in terms of being able to trigger exposure notifications for other people, because the app in the background can't look backward except from the point that you download the app. So if you don't download the app until the day they call you, then it's got no history to look backwards against. So super important that we get as many people as we can to download the app. So of those 9% who had downloaded the app, 78% accepted the code that would be needed that they would need to upload to trigger exposure notification alerts to other people. And we think that's a really good number of the people who had downloaded the app. This is going to work better if we can get more people to download the app in the first place. And 15% of the identified close contacts also said that they had the app. So what happens is if you are a positive person and you're able to identify your close contacts, say they have the app, they might get an exposure notification alert through the phone system and then get a call from a DPH contact tracer. If, on the other hand, the positive person doesn't know your name and you are a close contact, you're just going to get that exposure notification from the app. And that's why it's so valuable, because it's kind of like a catch-all. It's a way for us to catch the people that you're never going to know the names of who you may have been in contact with.
All right, thank you, Andrea. I just wanted to follow up on a few points that both Ben and Andrea mentioned. One, the app is available in both Spanish and English. All you have to do is click on Spanish language at the very top to change the language that it appears in. Ben alluded to interoperability. It's just a fancy word that means our app, COVID Alert DE, also operates in 3 nearby states, in New Jersey, Pennsylvania, and New York. All 4 states have embraced the same kind of naming convention. It's COVID Alert and then a 2-digit state name. So if you happen to go to Pennsylvania, your work takes you there, and you are in contact with someone, and later that other person tests positive, and you will be notified through COVID Alert DE that you may have been exposed to someone who tested positive in Pennsylvania. So we have that interoperability between states. And we also have, and Ben can talk more about this than I can, but their interoperability with some other states across the country, Wyoming, Virginia, and some others that have embraced this similar technology. Delaware was about the 6th or 7th state to roll out a exposure notification app. So we really are on the cutting edge of some good technology to help keep people safe. I think we mentioned that it's free. There's no cost to download the app. This is about public health safety. And then I just wanted to reiterate the portion about privacy and confidentiality. I know you serve some of the most vulnerable people in our state, and you are always concerned about them being exploited or potentially abused or something happening to them. And there is no one can get any information about an individual user. The only information we collect is in the aggregate. And I think as you saw, as Ben went through the demo, one of the categories that we do collect is disability status. We have a policy, DHSS policy, that if we can, we collect data about disability status in surveys or anything that we do as a department. And certainly this app fell within that we wanted to collect that information. The way we're going to use that in the aggregate is if we see a low percentage of people with disabilities who have downloaded the app, we may come back and do another session with folks from the disability community and see if we can increase that percentage. And we certainly falls into similar categories about age and race, gender. And if we see that we are falling short on some categories, we may have a push to try to go to target certain age groups or genders or race, ethnicity, because we are not reaching those groups. So that's why we're gathering that information in the aggregate. And I think it's very useful. I've been using it for a couple of weeks now, just to be able to track symptoms. Sometimes you wake up and in the morning you have a headache and you don't know if it's an allergy or something else, but to just be able to click that in. And then if, heaven forbid, you do test positive, it is very, very important to know when symptoms began. So that symptom tracker is very, very important to be able to have that. And you're not usually, when you go to the doctor and the doctor asks, when did this start? You say, oh, like maybe a week ago, 10 days ago. The symptom tracker gives you the precise time that your symptoms started. So just really, really important to have. And then I know we have some questions in the chat. Let me get to those. I think the first one came from Susan. And Susan asked, do you upload a 6-digit ID or do you receive one if you have been exposed? So Susan, this is how it works. So if you and I were together and later I tested positive, I would be in touch with a case investigator from the Division of Public Health or a contact tracer. And one of the questions they would ask me is if I have COVID Alert DE on my phone. And if I say yes, then they will provide the 6-digit code, because we don't, you can understand someone might want to think it's funny to upload a 6-digit code and send it out to their friends. This is our kind of our fail-safe to say, we know you have tested positive. Do you have the app on the phone? And we'll provide you with the 6-digit code. So then the person puts the 6-digit code to their phone, and anybody who meets that criteria of being in contact with that person who tested positive for 15 minutes within 6 feet, then they will get an exposure notification alert on their phone that they have been exposed to someone who has tested positive. And it gives you a list of things that you should do if you do get that exposure notification alert. So that's really important. So you have to be talking with someone from the Division of Public Health to verify that you have indeed tested positive. Dave Humes asks, will Maryland be coming on board? Ben, do you know anything about Maryland's status?
Maryland does currently have a contact tracing system. At this point, they have not come online to the same system that is being used by the 4 states. To go in more detail, the 4 states, actually Delaware, New Jersey, New York, and Pennsylvania, as well as, I believe, California, North Carolina, North Dakota, and Wyoming, use what is called the APHL, or Laboratories Central Key Repository. There are other states being brought online, as well as the Apple and Google exposure notification app that is being developed will also utilize the same key. The short answer is, as of right now, Maryland is not in that system.
Thanks, Ben. And then Susan Brown asked, when you complete your check-in every day on the app, do symptoms only come up for you to click on if you click that you have symptoms? I'm going to let Andrea address that one.
Hi, and the answer for Sue is yes, that the symptoms list only comes up if you indicate that you have symptoms. If you say, I have no symptoms today, it's basically the system says, great, I'm glad you're feeling well, have a good day.
All right, thanks, Andrea. And then Maria asked, is the 15-second video available in Spanish in social media? And Andrea, do you know? I don't know off the top of my head. I don't want to answer wrong.
I just went and checked on the site and tried to play it on the Spanish page, and it does not appear to be in Spanish. That's something that we can try to follow up on and see if we can get.
All right, thank you, Maria, for that question.
And I will add the link to the Spanish page specifically in the chat box.
All right, Pat Michael wants to know what protection policies are in place as recommended by the WHO. Who gets our information? How long is that kept? What else is it used for? Andrea, you want to take the first crack at that one?
Sure. So basically the only information, there are two sets of information that are captured by the system, and all of it is aggregate and all of it is anonymous. So the first set of data that is captured by the system are the number of people who have downloaded the app, the number of people who have uploaded a 6-digit code, and the number of people who have received an exposure alert. There is no personal information collected along with that, so there is no way for us to figure out who those exposures went to or who uploaded the code. The second set of data was the set of data that Jill was talking about. So when you're doing the setup, if you go in and you choose to say, oh, I live in this county and I am a white female within X age group, the system is collecting that information. That information is pushed to DPH from a secure feed from the app developer in your form, and we can take that information in aggregate and see how many people per county have downloaded the app. Again, there's no personal information being collected with it, so we don't know who from Kent County who has downloaded the app completed all of that information. And I guess the third set of information really that's being collected in the system is the symptom checker information. And so you can go through and say, I have this symptom, this symptom, this symptom, and you can track your own history. That is only kept on your phone. It is not available to our side of the system, and it's kept there for a 28-day time period.
Thank you, Andrea. And I think it's really, I want to underscore that point that this COVID alert, as Ben mentioned, uses Bluetooth technology. It does not use GPS navigation. It cannot track where you have been, who you've been with. It doesn't know if you're quarantining or isolating. It doesn't know any of that. It's strictly exchanging these keys between the phones. And in terms of the data, it is totally up to we say the user is always in charge. If you don't want to share any of that data, you don't have to. If you don't want to track your symptoms, you don't have to do that. You choose what level of participation you want to do and what kind of information you want to share. And if you say, I think this is intrusive, you can always delete the app and turn off the alerts and go away. This is really our ability to be able to connect people and add that layer of protection in order to keep people safe. We know, some huge percentage, 95% or more people have cell phones. So, and everybody carries them with them. practically 24 hours a day. So it makes sense to be able to embrace this technology and add that layer of protection by using technology to do it. All right, let's see what, have I missed any questions? I don't see any more. I'll just open it up. If anybody has any questions, the floor is yours, and or otherwise I have just a few closing comments. All right, as Ben always says, I'm going to take silence as a good sign. So let me just end with a few things. One, thanking our ASL interpreter, Pamela Adokio, for joining us. I want to thank Ben and Andrea for leading this conversation. Then I have just a few asks of you, or a few follow-up things. One, we will provide a link to the toolkit for everyone to use, both an English version and a Spanish version, and we'll do that. We'll add those links to the invitation so it's available to everybody. Secondly, my ask of you is if you go to de.gov/COVID alert, across the bottom, very bottom of the website, we have community partner logos, because we think it's really important to kind of have that good housekeeping seal of approval from different organizations. If your organization feels like this is something that you can get behind, we would love to have your logo and add it to the website. I think it's a sign to people that this organization, we have the University of Delaware, Delaware State University, the Delaware Restaurant Association, some others that think this has really good utility and embrace the technology and want to advocate on behalf of their members and their students that they should use it. So if you are in that position and want to share your logo, I would love to have that. We'd be happy to add it to the website. And then lastly, I think it's one of the things that's really important to have is, we call them influencer videos. There's somebody, if you or somebody from your organization would like to reach out to folks in the disability community and advocate that they use this technology as well, we would love to connect with you to create that video to reach more folks. You know, it's one thing if Dr. Rattay says people should use this video, or the governor, but I think it's really important to come from individual organizations and individual people. We just recorded a video late last week with Representative Melissa Reiner Brown, who's also a registered nurse, and to have her voice added to it really adds a level of credibility and a level of trust that people in the community think this is good technology, and it's another way that we can help keep people safe. So if you believe in that, if you want to take some time and look at the app, and you reach the decision that you would like to add your voice, we would love to have it, and we would work with you to create that video. So let's see. All right, Dave Humes asked, can you provide the link to this Zoom call that we can disseminate? Thank you, Dave. That's an excellent reminder. I asked Jeffrey to record this presentation, and we will provide that link. We know some people just couldn't make this particular time. And we'll share that link from the Zoom on that original invitation as well. Oh, and Andrew says we did discover that the 15-second video is available in Spanish. So we'll get you connected with that, Maria. Anything else? Any other last minute questions? Otherwise, I'm going to thank you all for joining us. I really appreciate it. I know your days are busy and you got lots of Zoom calls and more to come today. So I want to say thank you, and everybody stay safe, stay well, and stay connected. I really appreciate you being here today. Take care, everybody. Bye-bye.